Hi, I'm Dr. Tiffany Mayo, a dermatologist at the University of Alabama at Birmingham. Today, I'm going to discuss HS counseling for parents and patients. This education is brought to you by the HS Foundation. Part of the foundation's mission is to help educate all providers about proper diagnosis and treatment of HS. So, what is unique about HS counseling in adolescents and patients? Well, HS can be a difficult condition to understand for any patient. This is especially true for adolescents who may already be dealing with the challenges of understanding other changes that accompany adolescence and teenage years. Now, on top of this, the parent or guardians are involved and need to also understand the disease, but may not have a prior history or knowledge of HS. Now, because of their strong desire to help, without fully understanding the disease and what their child is experiencing, they may inadvertently cause conflict and additional challenges for the adolescent suffering with HS. What are key points to reinforce during counseling? One of the most helpful counseling pearls to create a cohesive family care and communication model is to remove blame and guilt. I may start off by saying, HS is nobody's fault. It's not because you bought the wrong soap or detergent or because of a bad deodorant. It's not because the patient is not bathing frequently enough or in the right manner. No one develops HS due to poor hygiene, products, or not eating enough vegetables. It is a genetic inflammatory condition. It's important to say these things. We may modify some of these things to best manage the disease, is what I usually say, but these things are not the reason the patient developed HS. Genetics is. Another important point is to emphasize that HS is painful, it's a chronic condition, and that patients may flare despite compliance. So I emphasize this to both the patient and parent that it requires long term treatment, and we may occasionally need to add rescue therapies for flare, regardless of how diligent or not the patient may be with the regimen. Finally, how can a parent best support their adolescent with HS? Well, of course, there are many ways, keeping track of visits and treatments, helping with wound care. But one of the top things I remind parents is to listen to their adolescent. Parents may want to be fixers, but with HS, the more important thing to their adolescent may be to have a parent or guardian that is a safe place to express emotions and concerns without judgment.